maybe.
Good evening, everyone. It's great to have you here tonight. My name is Alyssa Scarciotti. I'm the Clinical Education Manager here with Lexio Dental Laboratory Group. We are partnering with our friends over at Zest to bring you this program tonight. It's part one of our three-part series, Rethinking Edentulism. So we have on the team here presenting with everyone tonight, our very own Karen Gauthier here from Lexio Lab. If you want to say a quick hello.
Hi, guys. Thank you for joining.
And then we have, who probably needs no introduction, Amy Hilal, who will be doing the majority of our presenting this evening.
Good evening, everybody. Thank you for joining us. Appreciate it.
And also a man who needs no introduction, we have Todd Hydock here to help support Amy's presentation with any additional questions.
Hi, good evening, everyone.
So tonight we'll be covering in session one, fundamentals in overdentures.
So good evening, everybody. Again, I want to thank everybody for joining us. I'm excited to start this webinar series, this three-part webinar series with Lexio Dental Laboratory Group. And tonight we're going to be covering all about overdentures tonight. So the three-part series, we're going to cover overdentures. We're going to do a little intro as to what our next two webinars are going to be, where we transition into fixed full arch and then talking about our kind of digital and laboratory workflow. But tonight, again, being all about overdenture and overdenture therapy. So I'm going to be talking tonight about patient selection and case evaluation, implant positioning and restorative considerations, and some overdenture workflows, as well as, why to consider overdenture versus fixed full arch therapy. So just really quick, a little bit of housekeeping. We want to keep the session very interactive. So everybody on the screen has a comment box on the upper right-hand corner of your screen. So we are going to be monitoring those questions and going to be taking them throughout the webinar. And then at the end of the webinar, we'll have some time dedicated to answer all of your questions. So at any time, if I'm reviewing anything or you have a question about overdentures or locators or Lexio Dental Laboratory, please type them out and we will make sure to get those answered for you tonight. So without further ado, I want to talk about overdenture therapy. And at Zest Dental Solution, we pride ourselves on being the leader in overdenture abutments. So we take overdenture therapy very, very serious. And when we talk about overdenture therapy as a standard of care, that's really known throughout the industry. And we say the minimum standard of care is that overdenture. No longer is a traditional denture a standard of care. It's more that substandard of care. Because when you've got patients that are in a traditional denture, we know they're not wearing it. We know that they're uncomfortable. We know they don't eat what they want to eat. We know they don't have that quality of life that we want in our existence and what we want our patients to have as clinicians. So that 2-implant or 4-implant overdenture is truly that standard of care. It provides a better outcome for your patients. It provides chewing function, better aesthetics, just that overall better quality that we want all of our patients to have. Whether they've become an edentulous from terminal dentition or they've been a dentulous for a long time, there are no cases where a patient should not have that high standard of care. And we're learning as we move on with implant therapy, more and more patients are able to get implants, so that kind of when patients come into our offices and say, oh, my previous dentist told me I can't get implants or I can't get this overdenture, we know now with the technology that we have that about 98% of patients are able to get implant therapy. So that way, those patients with dentures, we can get them into this overdenture. And again, what's the problem? Low patient satisfaction with dentures. But as a clinician, we have low case acceptance rate for implants and implant involved overdentures. So we try to get this message across on how important and how easy it is to do an overdenture. That way you can take that to your patients and present that with them. And that a denture should not be even an option in your practice. It should be that implant retained overdenture, 2-implant or 4-implant for your patient. So how, as clinicians, how can we help patients better accept solution when they're on their path to losing teeth, Or how can we maximize your practice's earning potential with those cost alternatives to including implant therapy in your offices? So again, when we look at why implants, why do we talk about this? And yes, there is a revenue behind it, but it is best for that patient. And when you look at a chart like this, we see that obviously natural teeth is best. That's what we all strive for. That what are we going to eat? We want to eat a steak, you want to eat the sandwich, you want to eat all the foods you love eating. But when you have an edentulous ridge, or you have terminal dentition, extreme pain and infection, you're not eating that. And again, that quality of life goes down, your nutrition goes down, just your general overall well-being is greatly decreased when your chewing function and you do not have the teeth to eat and chew and live the way you want. So by providing a patient with a minimum, even the 2 implant overdenture therapy, we can see that functionality, that bite function increases dramatically, up to about 40 to 50% with a 2 implant, even more with a 4 implant overdenture, 60, 70, up to 80. And then of course, all the way up to fixed full arch therapy, which we are going to learn about later in our second part of our 3-part webinar series. So yes, while we can't replace their natural teeth, we can provide them with services to increase that function and increase that quality of life. And that's what implant retained overdenture therapy is for. So again, why overdenture? It includes stability. We know that because we know a denture rests on the ridge in the mouth. So when you add a couple of implants, it provides that retention, that snap-in effect to allow that prosthesis to sit in the mouth effectively and provide that great chewing function. So again, you have a better chewing function, efficiency, increased nutrition. You preserve the bone. And what we find is when your patient doesn't wear their denture, what happens is they lose bone. That's when they come to us with, I can't get implants. I don't have any ridge. And we've all seen those edentulous ridges that come in that are completely flat, where there is no bone. And that's due to a direct result of not wearing their denture, not having anything to support that ridge. And by providing an overdenture, we're actually preserving that bone for longevity for your patient. Improved comfort. We want your patient to be eating and chewing. And when they chew on their ridge, we know that's not comfortable. But just imagine what that would be like if we all didn't have teeth and we're chewing the dinner we had tonight without any teeth. And we know how uncomfortable that would be. And we know that we are not going to be eating the foods that we probably all ate tonight for dinner. So by allowing this prosthesis to sit in the mouth and snap in and have stability, we're taking out those obstacles. It is a cost-effective alternative to a fixed full arch. And when you think about overdenture therapy, it is full arch therapy. We are replacing a full arch of teeth, only with a denture, and we are retaining it with implants. Some patients do not have the finances to do a fixed full arch or all-on-X procedures, so a great option is still using an overdenture as an option. Overdentures have easier hygiene and maintenance, able to take it in and out, easier to clean, easier to maintain, and then adaptability over time. We're going to learn throughout this 3-part series on how overdenture therapy can lead that patient on a journey from edentulism to 2 implant overdenture to 4 implant to eventually even a fixed full arch treatment where the teeth are permanently fixed in the mouth, all while using the single abutment. So again, it's a little teaser to stay tuned and join us at our next webinar in February. And then again, high patient satisfaction. We find that patients, the minute you give them that overdenture, you are changing that quality of life. And I've been in hundreds of cases where these patients are extremely, extremely happy to just have 2 implants retaining that denture, and what an amazing process this is for the patients. When I say what's the case selection for an overdenture, who's able to get it? It's you're running through and talking to your patient. What's their chief complaint? They're not eating with their denture. It comes in and out. They don't like the goops and glues, as we see this lovely image of either adhesive or a reline that's coming off. And we've seen that time and time again. You obviously are going to review their medical and dental history, see if they are a candidate for implants, do a clinical exam. We want to make sure that the patient is able to get implants and allow for enough restorative space to allow for an overdenture to be properly made. That includes measuring the prosthetic and occlusal evaluation by making sure we have the correct spacing. You're going to go through your radiographic and CBTC assessment for implant placement, as well as implant planning. I'm going to talk about that in a little bit on how many implants and positioning, and then attachment selection. And there's a rationale behind it with based off of the implants and the angulation, which system that we are going to use, which inserts we're going to use to properly make a proper overdenture for your patient. When we talk about restorative space, we look at the bone, the implant, and all of the componentry that goes into your abutment, as well as the prosthesis. So when we say a great rule is around that 9 to 11 millimeters of restorative space per arch for a proper functioning prosthesis, because you want to allow that laboratory to provide that good, quality prosthesis that's going to last. And I'm sure, Karen and Alyssa from the laboratory can attest to that. It's hard when they get a scan or they get an impression, there's not enough restorative space, so they're making a thin prosthesis, and that can break over time. So when we're talking about who's a candidate for overdenture, yes, as I said, most patients are a candidate for implants, but we have to make sure they have enough restorative space to accommodate all of the componentry that goes into making an overdenture successful. And when you look at, measurements, it is definitely important to make sure that you're doing all of the diagnostic work ahead of time, that kind of pre-planning to make sure that your case goes off smooth. You want to make sure you've got the space. You want to make sure they can set the teeth, as well as allow for the acrylic for your denture, the abutment, the implant, and have all of the componentry able to have a nice, successful prosthesis. So, tonight we're not going too far deep into, implant planning and treatment planning, but we do want to be very well aware that when we are treatment planning for an overdenture prosthesis, that we have all of the bases covered and all of the requirements met to make a proper prosthesis. Here's just a good image of what we're talking about with that prosthetic space and abutment selection, because choosing the proper abutments is going to be your next step in the line. We have your patient. We've determined they want to have an overdenture. We've determined whether we're going to do 2 implants, 4 implants. Now we've got to talk about the prosthetic. We've talked about the prosthetic space. We have enough prosthetic and restorative space. And now we're going to be talking about how we're getting the abutments into the mouth. So when we talk about how many implants, and that is up to you, up to your patient, up to the bone and the quality of the bone and where we can place the implants. But traditionally we see for a 2 implant lower overdenture in that 22 and 27 position. Placing 2 more implants a little bit more in the posterior can accommodate a couple things. It can allow your patient for greater stability, but it also can lead your patient down the path of being a fixed prosthesis in the future by proper implant number and placement. And again, we're going to talk about that at our next webinar, but I wanted to highlight that implant placement is important and thinking about that for long-term as a journey for your patient. So even though they might say, oh, I want 2 implants, talk to them about the possibility of adding more, especially on the lower, adding 4, on the maxilla, we see in that image, even up to 6. That way you can remove part of the palate, or you can lead them down the potential of a fixed full arch with locator abutments. So implant number and placement is very important to think about when you're diagnosing and treatment planning your patient. But again, we've seen time and time again the success of a 2 implant overdenture and how successful that is, especially on that lower arch. So abutment selection. So at Zest, we're all familiar with our locator abutment, our legacy locator, that gold abutment that you're all familiar with. And for Zest, excuse me, the locator abutment is a brand. A locator is a branded abutment made by Zest. And we say that we are the leader in overdenture abutments because of the success we have with locators. It's used all around the world, and it's easily identifiable as that leader in overdenture abutments. And on the left, we see abutment. We see it's around 3.1 millimeters of restorative space, and that includes your abutment that attaches to the bone. Then we see in the middle, we do have the ability, if we do have to correct some angulation, we do have the option of adding an MUA or a multi-unit abutment on top of the implant, adding a collar, and then adding a locator on top of that. As you can see with the image, it does increase the amount of restorative space used by the componentry. And at Zest, we've just recently come out with an angled abutment. We are very, very pleased to announce our locator angled abutment that has come out recently within the last year. And we've been asked time and time again, we need an angled abutment. We need an angled abutment. And we heard you, and we agree that having an angled abutment is essential, not only for correction of angled implants, but for the success of a case, whether it's for a 2-implant overdenture, 4-implant overdenture, or again, eventually getting your patient to a fixed full arch using locator abutments. So our locator angled abutment is a great option to include into your practice. Our angled abutment corrects up to 15 degrees of angulation.
Amy, real quick, I'm just going to interrupt. We have a question here.
Absolutely.
Can the overdenture be fixed with the new attachments on 4 implants? Question mark. I've
Yes.
used this for years for a removable overdenture. If this can be fixed, can it be placed same day as the implant placement, or do you need to wait 4 to 6 months before attaching denture?
So great question that we are going to absolutely dive into deeper at our next webinar, but really, really quick. Yes, you can attach a fixed prosthesis to locator abutments. It's going to be some different componentry, different housing, and a different insert, different prosthesis design. It's not going to be a denture. It's going to be that more fixed hybrid design where you're making it cleansable for the patient. But because it's fixed in the mouth and not removable, you can immediately load it as long as you've got 4 implant as a minimum and good stability with your implants. So you absolutely can do that same day. And we are absolutely going to highlight that at our next webinar.
Excellent. Thank you.
Thank you.
Great question.
Absolutely. So when you look at this image, this is one of my favorite images that I show when I talk about locators for overdenture and fixed. It's the compatibility that locator has with over 350 different implant connections. So when you look at this image and you see all these different implants or abutments, it almost looks like they're all different. But when you look at that working end, that top end of the abutment, it actually is all the same. So the beauty of locator is its compatibility. You as a clinician come to us or go to your lab and tell them what implant system you're using. We determine the connection, which at Zest, again, we fabricate and manufacture implants that are compatible with almost every implant system. But that working end, that top part of that locator abutment is the same across the board. So if you were to look at all these images, you see all of that top working end, the end that gets snapped in with the insert, goes into the housing, above the gum line is all the same. So that is the beauty of using a genuine locator abutment. It's compatibility with almost every implant system on the market. All you need to do is tell us the implant system, the platform, and we can help guide you to what locator abutment is going to be best for that case. So with that, now we know how many implants we're placing, where we're placing them in the mouth, what abutment we're using. Now it's the matter of selecting the correct size of the abutment. As you can see in this image, we see all different sizes from short to taller implants. And that's very important. And we find that we had a conversation earlier about that on the laboratory and I on the challenges with that and making sure we're selecting the correct abutment. So measuring abutment height is, to me, it's one of the most crucial aspects of doing an overdenture. So yes, we know we're going to do locator, a Zest locator. We're going to do 2 implants. We're going to make it an overdenture, and this is great. We don't just select one locator abutment. They are measured specifically for each implant at each site because each implant is placed differently in the mouth. Some are a little bit more subgingival, some are a little bit more at the crest of the bone, some has more gum tissue around, some has less. So we want to make sure we are measuring that cuff height or how tall that locator abutment is appropriately for each individual site. So if you have 2 implants, you're measuring those 2 sites separately. If you have 4, you're measuring all 4. And you're measuring all the way around your platform of an implant, or I like to do it almost like as the hygienist in me, like you're measuring a perio pocket. You're taking mesial, distal, buccal, lingual measurements because the tissue might be different all the way around. So when you're measuring, you want to record the highest number, meaning the deepest pocket. So if you see in that picture with the arrows, you're measuring that cuff of tissue all the way around. And if you measure 3 millimeters all the way around how deep that tissue is, you order a 3 millimeter cuff height. If it's 1 on the mesial but 3 on the distal, you order a 3 millimeter cuff of a locator abutment. That way that ensures that the abutment is either not subgingival and impinging on the tissue when you press in your overdenture, or it's not too tall. And if it's too tall, that eats up some of the restorative space, it can cause rocking or an ill-fitting overdenture. So here's another graphic of what we mean when you're measuring that platform of the implant, in that deepest point of the gingival tissue, and that is the cuff height. You don't need to do any other measurements. You don't need to add any other additional height or math. We've done that for you at Zest. All you need to do is measure that gum tissue, and that's going to be the locator abutment height that you're going to be ordering. As you see with our locator angled abutment, because those implants are angled, you're going to be doing the same technique, is measuring that cuff height and ordering according to that deepest measurement. Alyssa, I'm sorry, did you have a question, or did somebody have a question?
No questions. No.
Okay, sorry about that. So I'm like, I heard somebody was making sure there wasn't a question or I wasn't skipping through it. So with locator angled, as again, you're compensating for that tipping of the implant, so you will measure the deepest point of your cuff height for your locator angled. The locator angled does come in half sizes or half increments as far as the heights. So here's a great image of why we want to measure for each site. As you can see, these cuffs a little bit tall. We've got a 3 millimeter, and a 2 millimeter, but that working end is parallel, or is kind of parallel to the floor, so that is all even. But you want to measure each site. Not each site is created the same. So if you ordered 3 for 1, doesn't necessarily mean all the sites are 3. So again, it's very, very important, and I know the lab can back me up on this. Measuring your abutment heights is extremely important for each individual implant site. As you can,
crucial. Amy, it is crucial.
Yeah, she wanted me to highlight that. So Karen, if you wanted to just quick talk on that really quickly while we're on that subject.
Might as well. So yeah, this part is very important, guys. This is what kind of makes or breaks the turnaround time for your cases. If something's off and we see a discrepancy, then you're going to get a phone call from our lab and saying, hey, we need you to remeasure or re-pick up. So as measuring is crucial. Make sure you do it right. I'm actually putting something in the chat right now. As you can see, this is like my biggest thing, measure, 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 because this will make it or break it.
Thank you. So I agree. That is one of the most crucial points of making a successful overdenture, is picking or selecting the proper abutment heights. I can't tell you how many times I've gone into an office and a doctor just uses, I just use a 2 or I just use a 3. Yeah. But how do we know? And when you look at this image, especially on the lower arch, not only do we have a lot of locators, that bad boy isn't going anywhere, but you can see kind of the discrepancies in the heights. So, some of them are a little bit, but those posterior ones seem a little bit subgingival to me. The housings might snap in and pinch the tissue, but that one in the anterior is really, really tall. So that's just going to make for the lab technician to have a difficult time fabricating that. And for the patient, we want it nice and even across, across the arch, that we have a nice, well-fitting prosthesis.
Amy, I just want to mention real quick, we had a question come in, does Zest do removable lab work? And then, no, but we do.
We do not, but that is why we have an amazing partner with Lexier. So yes. At the end, at the end of this presentation, I'm going to have all of our contact information. So, which is great. You can reach out to Alyssa or Karen and talk about how to submit a case to the lab.
Yeah, I definitely think, that's why we work so closely with you guys, because, the education that you provide, in partnership with us, and then having the right lab partner just leads to success.
Absolutely.
It does. It definitely does.
And they work with locator just all day long. So that's why, they're great. We're a great partner together, be able to help you select the abutments, select the how many implants we're going to do, and then you send it off to the lab to fabricate an amazing prosthesis. So that's why we are here in partnership together to help you be successful for your patients. So in addition to measuring the cuff height, I could probably do an hour-long webinar just on measuring cuff heights. Which I know we don't have that much time tonight. I don't think anyone would want to sit through that webinar. But another step in fabricating your overdenture and the importance is angulation. And measuring angulation is just as important as measuring that cuff height. And the rationale and the reason is, at Zest and with locators for overdentures, we have different tolerances of our nylon inserts to correct angulation. It is not one size fits all for those nylon inserts, those colored inserts that you're changing. So with locator, we want to measure each individual implant. Just like we did for the cuff, we're measuring each individual angulation to ensure that we are selecting the proper nylon inserts to go with the case. So when you're
another quick question that came up,
Mm-hmm.
and I'll probably refer this to Karen. Would it be better if I order the locators myself or let the lab do the ordering?
Actually, I just answered it in there, but
Okay.
you should probably have the lab, and I'm hoping you're using us, have Lexia order it for you, because we're going to be doing the work. So make sure that we have the proper pots for that case. So a lot easier, less headaches for you and worry. Let us deal with that.
And then we did have a question about CE. Everyone attending is earning 1 CE credit tonight.
Correct. So for angulation, we have a little ruler, like I showed you in the picture here and the one previous, and that helps determine the proper angulation. I've been doing this for many, many years, and I'd say I'm pretty good at looking in the mouth, but I still can't determine the angulation just by eye. So it's very, very important to measure that properly with the proper tooling to determine which way you're going to go. It's each insert has a tolerance or a capacity to accommodate a certain amount of angulation. I'm going to show that in the next few slides. And if you're outside of that range or that tolerance, you're not going to have a successful case. So it's very, very important for each implant. Not only are you, again, selecting the proper cuff height, but you're selecting the proper inserts based off of the angulation of that implant. So with Zest, with our standard abutments, as we're showing here, in our standard range inserts, those are the blue, pink, and clear that you're all familiar with. Those are called standard range. They have the little button in the middle that you can see on the image. Those correct up to 10 degrees of angulation per implant, or 20 between two. So when you look at this image, you see your standard range inserts, blue, pink, and clear, your locator abutment. And again, you want to be within that 10 degree. So as I showed you on the ruler, it's important to know if it's outside of that 10 degree, that insert is not going to snap into the center portion of your abutment. So if you've ever had cases that come back, or the patient goes home with their overdenture and 2 weeks later they come back that it's loose, they're upset at you that it keeps popping in or it's not snapping in, my number one troubleshooting is, what's the angulation? Because if you're trying to use a standard range insert on an implant that's outside of the 10 degrees, that button is not going to fit into that center part of the locator, that nice path of insertion. We want a nice passive denture seating when we're putting that overdenture in. So if your implants are outside of 10 degrees, that middle button is going to kind of jam into the center and it's not going to fit properly. So it's very, very important to be very aware of angulation, as well as, again, cuff height we talked about, but making sure you're using the correct inserts based off of the angulation for each implant. Locator inserts come in 3 different retentive values. So you have your blue, pink, and clear, again, basically low, medium, and high, or 1.5, 3, and 5 pounds respectively. So I always recommend we start with the lowest retentive value, because you can always go up. It's harder to kind of go back down. If you start your patient with the strongest and they say, "Doc, I want something a little bit tighter," or they just feel they need something tighter, we really don't have anywhere else to go. So we recommend always starting with the lowest, the blue, work your way up, but ensure that you're using the proper angulation insert, because that'll affect it as well. If you are using the standard range outside of its 10 degree of tolerance, you're not going to have a overdenture that's going to snap in properly. And when I talk about standard versus now extended range, overdenture does, or locator overdenture does have what's called extended range nylons. These are nylon inserts that, as you can see from the image, we've removed the center button on the inside of that insert. In the that allows for the insert to swivel and pivot inside the housing on top of the abutment to allow for a greater degree of divergence or convergence of those implants. So the extended range can accommodate up to 20 degrees of angulation per implant. And that's important to know, because not every implant is placed perfectly parallel. So you might have one implant that's perfectly parallel, but one that's outside of that 0 to 10 degree tolerance. So for one implant that's parallel, you use a standard range. And for the one outside, a little bit further out, that 10 to 20 degrees, you would use the extended range. Again, it's very, very important, because the path of insertion, we want to make it as easy as possible and passive as possible. And so with the using of the proper inserts, that's going to help you be successful in your overdenture case. So be very aware of what angulation you're using for each individual implant. Again, we also have 3 different tolerances: low, medium, and high, or basically 1.5 to 2, and instead of 3, it's 4 for extended range, because you don't have that extra retentive value of the internal button. So it's increasing the retentive value on the external portion of the abutment. That's why they're a little bit higher for your extended range. We do have what's called a gray insert or a zero retentive insert. I recommend that all of you have these in your office as well. When the laboratory is processing your housing into your denture, or you are doing a chairside pickup, it does come with that black processing insert. That's a plastic black insert that you use only for your pickups or for your trying in of your prosthesis until you change them into your colored nylon inserts. I do not recommend that the patient goes home with those black inserts. They're just plastic. There's no retention in those. And I understand that some patients have limited dexterity and have a harder time removing in their overdenture, but swap them into the gray nylon insert. The nylon is going to be more durable, it's going to protect your abutment, and it's going to get greater longevity out of the life of your overdenture for your patient. So if you do have a patient that is, even the blues are too hard for them to remove, swap them out for the grays, or you can mix and match. If you have 4 implants and maybe 4 blues are a little bit too tough for your patient, you can alternate blues and grays. But it's important to note that we recommend you swap out the black processing for the gray zero retentive insert. Going back to that angulation, again, standard range is 0 to 10 degrees, extended range is 10 to 20 degrees, and our angled abutments that I talked about earlier. These abutments correct up to 15 degrees of angulation on their own, but when used with an extended range insert, which accommodates up to 20 degrees, you actually can correct up to 35 degrees of angulation. So again, I know it's a little bit harder to kind of articulate, but when you use your extended range insert, which has a tolerance of 20 degrees of angulation correction, combined with the 15-degree angled abutment, that's where I'm getting the 35 degrees from. It's adding the 20 degrees plus the 15 to get you to 35 degrees. So that's a great degree of divergence. Yes.
Sorry to interrupt. Karen did answer this in the chat, but I just wanted to make sure, in case people aren't monitoring the chat. Can you mix the standard with extended? And the answer was yes.
Yes, you can. Absolutely. I like to stick with the same poundage. So if I'm using blue, which is the lowest tolerance, I stick with the lowest tolerance for extended range inserts, just to make it even across the board when you're taking the overdenture in and out.
Great, thanks.
So for locator angled, again, it can correct up to 35 degrees of divergence or convergence. The beauty of locator angled is that obviously it can use for an overdenture, but it actually also can be used for locator fix, which we're going to talk about at our other webinar. For locator overdenture abutments, you're familiar with that triangular driver that you insert your overdenture with. You're going to torque that into place. With locator angled, there is an 050 screw, hex screw, that does go into the center of it, because it does have 6 different timings to allow for different positionings to correct that angulation. So that is the only difference for locator angled, is you cannot use a standard range insert in that, because you do have to seal up that access hole once you do tighten the screw into the locator angled abutment. So you do have to use the extended range nylon inserts, because it does not have that little retentive button on the inside of the insert. So for locator angled, you would always use the extended range inserts, but then again, on a traditional locator abutment, you can mix and match standard range or extended range based off of the angulation of your implant. So once we've measured the cuff height, selected the angulation, we know which angulation we're going to get, now we can go ahead and process and kind of connect the two and make that overdenture. So whether the laboratory is doing a pickup and is sending it back to you, or if you are doing a chairside pickup, I'm going to just highlight that a little bit. You want to make sure you have a well-fitting denture. You have your abutments in place. Everything is torqued down. We want to make sure everything is torqued into place, not just hand tightened, but torque it based off of your implant manufacturer's recommendations. You want to indicate where those abutments are. You're going to drill out that recess to make sure that we have enough room for the abutment and the housing, to make sure that, again, the denture is passive before you connect all the pieces and parts together. So you have a denture, traditional denture. We've indicated it with the housings to make sure that we have the proper recesses. We want to verify the occlusion and verify with the housing on. That way we make sure that we have enough room to pick up the housing into the prosthesis. So if you are doing
Amy,
this chairside, yeah.
Sorry, a couple questions. What is the recommended torque to tighten the screw?
So for the torquing of your locator abutments, it's based off of your implant manufacturer's values. So whether it's that 20, 25, or 35 Newton centimeters, again, that's based off of your implant. That's what you're going to base off of the torque value.
Okay, perfect. And then the next one is, what do we use to close the screw channel for angled?
For locator angled, I do a little bit of Teflon tape on top and then a composite, just like a flowable composite, just to seal off that access hole.
Okay, and then the next question was, will we have access to this info after the webinar? And the answer is yes, we will share
Yes.
the recording with everyone.
Absolutely. So if you are going through a analog process or workflow for locator overdenture, we do have impression copings that snap onto the locator abutments, and then you'll move through with an impression. As you see here really quickly, I know I'm going on. I want to make sure we have enough time for some question and answers, but you'll place your impression copings on, take a regular PVS impression, send it to the lab, and they will provide the analogs and fabricate your overdenture that way. If you do want to go with digital, we actually do also have scan bodies where you could scan, and we are going to highlight scanning on our third webinar series, kind of that digital and analog workflow. So we'll get into greater detail on that at our third webinar. But we do provide scan bodies, and you can scan that and send that to Lexir as well, and they can fabricate off of a digital scan. Again, really quick, if you are going to do a chairside pickup in the mouth, you want to make sure you're blocking out your abutment. You have your housing on, making sure that none of the locator abutment is showing through. We want to make sure that everything is sealed, and we're not going to lock in that pickup when you are doing that in the mouth. Whether you're using blockout spacers or blockout material, you want to make sure everything is aligning properly. Again, that goes with measuring the proper abutment, selecting the proper angulation. All of these are going to help you to do a successful pickup, even if it is laboratory or in the mouth. It's all of those steps are going to ensure that a proper overdenture is fabricated. Once you fill that hole up, that recess that you've made, we do recommend a lingual vent hole to allow for proper pressure and picking up of the housing. You're placing your either acrylic or chairside material in your prosthesis, picking it up in the mouth. And as you can see with this image here, you've got the black processing spacer, black processing insert in. That's what you are going to be using to kind of polish and finish your overdenture. Once everything is finished, you remove the blackout spacers, any flash, fill in any voids if necessary, and that's when you go ahead and change out those colored nylon inserts. That's what that black is for. It's for laboratory processing or processing chairside after you've done a pickup. That's why it's very imperative to make sure that you remove them and then place them with the nylon inserts. Again, you're making sure you're selecting the proper insert based off of your angulation, whether it's standard range for 0 to 10 degrees or extended range for 10 to 20 degrees, or if you are using that angled abutment, you're using the extended range nylon insert for your angled abutment. Really quick, overdenture maintenance. So once we've kind of fabricated the overdenture, we've ensured that the fit is great, the occlusion is great, the nylon inserts are properly inserted based off of the angulation. It's very important to maintain hygiene for your overdentures. We always like to say, yes, we can't get any cavities, or patients say, this is great, I can't get a cavity. But yes, we also can have implant failure. You can have your patient have periodontal disease, implant loss. So it's very, very important when you're delivering overdentures to your patients that you're not only just delivering it properly, showing them how to properly seat and remove your prosthesis. I always make sure that the patient knows to properly grab the prosthesis and evenly pull it out with both fingers on even side for your implants, not flipping it out with their tongue, not biting it into place. When you're doing improper movements like that, or the patient's not properly seating it and removing it, that can cause excess wear on your overdentures, on your abutments, and cause premature implant failure. So it's very, very important that your patient is very comfortable removing and seating your overdenture prosthesis to make sure that that's going to provide longevity for your overdenture abutment. For hygiene, very important that they clean their prosthesis properly. We recommend that if they are going to soak their prosthesis in an Everdent or an effervescent tablet, 15-minute maximum. Anything over than that can degrade the nylons and cause wear over time. Non-abrasive toothpaste, soft bristle toothbrush, electric toothbrush definitely helps stimulate the blood flow of the gum tissue around it and helps clean out those locator abutments. If you look at that bottom picture, you see that the top portion of those locator abutments are occluded with food or plaque, calculus. We want to make sure that those are cleaned out in gold every day. So I like to give my patient a mirror, show them in the mouth what it looks like, show them that they should be cleaned out properly every day. At Zest, we have 2 different products that we can also use to help protect your prosthesis. The first one is Regal Protect. It's a silicone-based kind of material that is painted on your prosthesis. The laboratory can paint it on, or the clinician can paint it on. It's tasteless, odorless, and you do not feel it. And what it does is it provides a protective barrier that lasts for 6 months on the prosthesis to inhibit bacterial growth. So it's a great option to add to your treatment when you're delivering a brand new overdenture, because it can inhibit that biofilm, which can obviously cause damage to your prosthesis, damage to your abutments and implants, and then eventually cause periodontal disease if not cleaned properly. So Regal Protect is an amazing product that we've developed that can help you increase the longevity in the life of your overdenture prosthesis, as well as any fixed full arch prostheses that we're going to talk about later. Another option is what's called Regal Go. And what this is basically a toothbrush on the go for cleaning of your prosthesis. But not only, as you can see in the pictures to the right, not only is it a great option for overdenture therapy, but it can help with single tooth implants, especially if you've got, single tooth crowns, bridges, orthodontic patients. It's a cleaning product. It's basically a surfactant-based, xylitol-based, non-fluoride formula that you could use on the go to help clean underneath the prosthesis and help, again, inhibit that bacterial growth. But especially with overdentures, it is easy to remove. You remove the prosthesis, brush, you can soak it for the 15 minutes, and then have your patient reinsert their overdenture for after if they are eating or wearing their overdenture. We definitely don't recommend that the patients are eating without their denture in, or if they are a smoker or a vapor, make sure they also have their overdenture in the mouth. We want to make sure that the overdenture abutments and the implants are protected. So it's very important that they are properly instructed on overdenture maintenance and hygiene. For insert removal and maintenance, we get this question a lot. How often should I change your inserts? And my recommendation is basically to still see your patient for hygiene visits. They still should be seen every 6 months to a year. At that visit, we recommend that you do swap out the nylons because they do wear. And the more you maintain the nylons, the longer you're going to have longevity of your locator abutments and your prosthesis. So definitely changing them out every 6 months to a year, or if they do come in prematurely, if they are worn. If your patient is coming in more frequently, let's just say every few weeks or few months, troubleshooting is check that angulation. Check to make sure that the patient is cleaning properly. If you've got perfectly parallel implants and you're using standard range inserts, and that top surface of your locator abutment is occluded with food or calculus, those retentive buttons on the inserts are not going to fit into that locator abutment. So it's imperative that the patient knows how to clean it so that the nylon inserts can properly snap into that locator abutment.
Amy, there was another question here. So we had the one for the average patient, how long should the inserts last, which I believe you addressed that, change out every 6 months to a year when they come in for their hygiene. And then the other one was how often do the locators need to be replaced? I'm assuming they mean the abutments.
Yes, so the locator abutments, that is based again off of your patient's kind of parafunctional habits, their maintenance, their hygiene. We've seen locator abutments, I've seen them in the mouth 20 years. But I've also seen them wear out after 5 years. So if what you're looking for is, you see in the image, obviously a nice gold locator, when you start to see it wear or you start to see kind of a silver form, that's when you know that locator abutment needs to be changed. So it's very, very important at each hygiene visit, you're checking the torque value of your abutment. Make sure because you are hand screwing it in, but then torquing it in with a torque wrench. But at each recall, I recommend that you just go in and check the torque value, make sure it hasn't come loose, and then look for signs of wear. Look if you see silver, look if you see kind of, again, that lip of the abutment starting to wear down, and you'll see it visually. And if that's the case, then you absolutely want to swap that out. But we do see on average, it could be anywhere from 5 to 7 years before you have to change out your abutments. But just like with anything, mechanical, they do need to be replaced. I know, artificial joints, they need to be replaced every, 10 to 15 years. So do locator abutments. They take a lot of wear, by removing your denture in and out frequently every day. It does cause some wear on that abutment. Another thing to talk to your patients about is that habit of how often they remove their overdenture. Some patients have a habit of playing with their tongue, or they're flipping their overdenture in and out, or biting that overdenture into place, or again, using their tongue to remove it. That can cause premature wear because you're pushing forces on different parts of that locator abutment. So you can have premature wear just based off of improper kind of removing and seating of your locator abutment. Again, improper hygiene and maintenance can cause premature wear. And again, not wearing your overdenture. I've seen patients chew on their overdenture abutments. They think they're, cool gold teeth, and they're chewing on them, or they're smoking without their overdenture. So not having that protective overdenture over the abutments can cause premature wear. But yes, they need to be changed and monitored for signs of wear. So that's important at a recall visit as well. Really quick, we also provide a tool at Zest. We have a very convenient denture removal tool. So if your patient is having a hard time removing it with their fingers, or doesn't want to get their fingers in their mouth, we do have a plastic tool that can help remove the prosthesis easier, and just help to get that patient to be more compliant with proper removal, seating, and maintenance of your prosthesis. So before we kind of get into some Q&A, I think I've got a few more minutes before we wrap up. I wanted to tease and kind of lead into what our next session is. So tonight, I know I ran through things very quickly. Again, I could talk hours and hours on overdenture therapy. So the point of tonight's webinar is to highlight overdentures, highlight the importance of locator overdentures, as well as working with an amazing lab like Lexier to make sure that your cases are going smooth. So when you've got the great product, such as a locator, a great laboratory, such as Lexier, and yourself as a clinician, all three together can make this prosthesis for your patient and make a successful prosthesis. Again, going back to that standard of care I talked about in the beginning of the webinar. So with that, it doesn't mean that a 2-implant or a 4-implant overdenture isn't a great option. These are great options. Again, talked about them tonight at length, talked about the benefit of them and what they can do for your patient. But what's that next step? And usually we say, patients, what's their end goal? When you talk to your patients and doing treatment plan, we say, what do you want out of your treatment? Where do you see yourself? And a lot of people say, oh, I want my teeth back. I want to be able to chew anything I want. I want to be able to eat anything I want. I don't want to take my dentures in and out. Love the overdenture, love that it snaps in and out, but I don't like doing that. Or a lot of patients are still embarrassed about removing their teeth, so they don't. And we've all seen those overdentures that have come back that have never come out, and what that looks like underneath and what that does to those implants. And I get it. Patients might not want to remove it. They might be afraid to move it or can't remove it. So we say, well, I want fixed teeth. I want all, teeth that don't come in and out. And when we've talked about it in the past, that screw retained All-on-X, again, great option. Beautiful, beautiful option. Beautiful material with zirconia, and it's a wonderful prosthesis, but it's very technologically difficult. As a clinician, it's very technical. As a laboratory, it's very technical to do, and that deters a lot of clinicians from doing fixed full arch. Also, the price point, that deters a lot of patients from doing fixed full arch. So you've got patients that want permanent teeth, but do not have the financial means to get that fixed full arch at $20,000, $30,000, $40,000 an arch. So what can we do? What we found that was a big gap in treatment of patients. But what can we do as a company, as partners with a laboratory, as providers to you, as clinicians? What can we do? And we found that with our development, our engineers have developed a process of using locator abutments to make a truly fixed prosthesis, and we call that locator fixed. And you might have heard about it. You might have seen it in publications or just in your CE journeys. You've heard locator fixed, and a lot of people get confused because when you hear overdenture, or locator rather, you think overdenture, you think removable, and that's amazing. But we're going to find out at our next webinar how we can use the same locator abutments, changing a few things, which I'm going to show you really quick. Changing the housing. So I talked about the housing for overdenture at the top, that silver housing. Talked about the inserts, the nylon inserts, those blue, pink, and clear removable inserts. And that appliance, that overdenture appliance. It's a denture. It uses the tissue in the flanges as support. It uses the implant and locator abutments as retention, because an overdenture is implant tissue supported, but implant retained. So it uses the implants kind of like a snap to hold it into place. But what can we do to make it permanent? And at Zest, we developed a procedure and a product called Locator Fixed, where it's a different housing, different inserts. And we're going to highlight that at next webinar and how that all works together. And with changing the prosthesis design, so it's no longer a conventional denture and an overdenture, it's now a truly fixed prosthesis that's cleansable and unable to be removed by the patient. But the beauty is you're using the same abutment. You're using one abutment that you either are not changing or you're adding a locator abutment to an Edentulism patient. In the process, that workflow is going to be the same. We're going to highlight that at our next webinar. So again, the beauty of locator is it truly can take your patient from a dentulist or terminal dentition on a journey from a 2-implant overdenture to a 4-implant overdenture to eventually being a fixed full arch case, all while using the same abutment that you're comfortable using. So that's kind of my teaser on what we're going to talk about at our next webinar on February 3rd. Now with that, I'd like to lead into what that is. So I have a QR code for anybody that has not registered for our next webinar, but to join you on our next series with Lexir Dental Laboratory Group and us as Zest, we are going to be highlighting how locator abutments and locator fixed can get your patient into that next phase in treatment. And that's going to be getting them from an overdenture, or whether we had that question earlier in the webinar, can we do immediately load? And yes, we can. We're going to discuss that, how we can get our patient from terminal dentition, or let's just say a dentulist, and we're placing 4 implants to fixed full arch therapy in one visit. So that is going to be our session for next week, or I'm sorry, it's in 2 weeks, February 3rd, again, 7:30 to 8:30 Eastern Standard Time. Same thing as you did for today's webinar. You're going to sign up and we will be more excited to see you. Everybody, we hope everyone that's on this webinar today is going to be joining us at that next webinar. So I'm going to pause here. Actually, I'm going to go back, and that way, if anyone wants to scan it before we give our CE credits, I'm going to open the floor to Alyssa and see if we have any other questions that came through, or if anyone has any questions now, they can type them in.
We do have a few questions, Amy. I didn't want to interrupt. Okay, so the first one is how to establish angulation in the case of 4 implants.
So what I like to do is that angulation measurement ruler that I showed you on the slide. I measure that for each tooth. So each implant site, you can absolutely measure them between 2 implants. So if you're having your standard range insert and it says 10 degrees for implant or 20 degrees between 2 implants, that's why I like to measure individually each implant based off of where they are, off of that kind of midline, that parallel midline. So if 22 is at 10 degrees, that's going to be standard range, and 27 is at the same. But let's just say the 2 posterior ones, you're measuring them and they're 20 degrees off that midline. Those would be extended range inserts. So again, it is hard when you've got multiple implants. It's where are they comparing? Are you doing it from the 2 anterior ones? Are you doing cross arch? That's why I like to measure each implant individually. I measure mesial, distal, and buccal and lingual and kind of see where that implant is placed to determine what that angulation is off of what insert I'm going to be using.
Okay, excellent. Thank you. And Karen, if you have anything to chime in, just feel free to add. And then the next question is, any comment about root locator? Do they last? I have patients. Oh, sorry, the thing just another question. Questions are coming in and it's moving. I have patients who may not like to have implants or they are not eligible due to health reasons.
Absolutely. I love a root locator. I know people think it's an antiquated service, but it really is not. Root locator is a great, great viable option for just what you said, those patients that have financial limitations or even are just either unable medically to get an implant or afraid. So a root locator is just like I think of it like a post and core, where you're going to root canal a tooth, usually a premolar or a canine. You kind of shear that tooth down to the gum line. You drill right through the center. Of course, it's root canaled already, and you cement it in with a dual cure resin-based cement. That working end that I talked about earlier is going to be the same across the board, whether it's a locator that you put in an implant or a root locator. It's going to be the same housing and the same inserts. You don't have to do anything different. The difference is just the protocol of getting that root locator inside of the root. The longevity on that is going to be determined based off of your patient's hygiene. It can decay. So you still can't get recurrent decay around it because it's a natural tooth. But with proper hygiene and maintenance, I've seen them last anywhere from 5, 10, I've even seen up to 15 years of a root locator. Risks are fracture. You can risk fracturing that root because, again, you're drilling into the center of it. So you're causing a discrepancy in the integrity of that root. But again, with proper care and maintenance, you can get a good long-term solution out of that. A great option for root locators also for partial denture patients that have, posteriors and a partial, but they're keeping canine to canine, and those clasps are either wearing that canine, causing a abrasion or root decay, or it's just unsightly. So that's absolutely a great option of doing a partial retained or an locator retained partial denture. So I'm going to put my contact information at the end as well as everybody on this call. But if you have a specific question on root locator, I can absolutely reach out and go into a little bit greater detail on that.
Excellent. Thank you. Do you have Zest courses that help me plan and place the implants where they have to go and then restore them?
Absolutely. So our mastership course, we have a course called Zest Mastership. It's a 2-day course. We hold it in Las Vegas, Nevada, which is our global education center. And we actually also hold it throughout the country. We have Cleveland, Florida, Orlando, Dallas, Texas, San Jose, California, Washington, D.C. We're going to be also in New Jersey and Atlantic City. So we have courses all throughout the country. And our 2-day Zest Mastership. So I want everybody to, any questions on that, reach out to myself or even visit zestdent.com. Just Google Zest and you can go to our education tab and learn all about it. It's a 2-day course, 39 CE credits, where there's didactic and live. In our Vegas center, we have a live patient and we cover everything from overdenture to locator angled, locator fixed, locator implant. We talk about implant placement. We practice of implant placement, restoring all of this. It is a truly, truly comprehensive education from everything overdenture, implant, and full arch therapy. So again, thank you for bringing that up. I will make sure at our next webinar to highlight some more of our education. But in the meantime, please visit us at zestdent.com and we can answer some questions on your education.
Awesome. Okay. How do you pre-measure the cuff height for the locator on a same-day fixed overdenture?
So that's going to be, you're going to still measure that primarily based off of your initial assessment. So yes, if you are placing same day, you're going to try to assess the gum tissue just off of your initial examination. I do recommend, if you're going to be doing that, to have several different cuff heights in your office. So if you have maybe a 2, a 3, and a 4, keep them off to the side. Once you place your implants, you can try them in. They are sterilizable. So if you're not using one, then you can re-sterilize it and keep it for another case. So definitely, if you are doing a same day immediate load, you want to have a couple different variations of cuff heights to make sure that you're going to be successful. When you bring your patient back, especially if it's fixed for their definitive prosthesis after the gum tissue is healed, you're going to have to remeasure as well. So yes, there is that kind of part in there where you're picking a few different cuff heights, but having a few different in stock, or again, talking to your lab and having them help off of a working model to make sure that they're maybe ordering the proper cuff height. But if you are doing immediate load, it is usually the case where you have to have a couple different sizes on hand.
Okay. Yeah. And Karen did mention here that Lexi, us as a lab, we do provide chairside support. So, for whether you're new to this or you're just, it's a little bit more of a complex case, Karen's role is she does go out chairside and provide support. So
awesome.
Happy to. And we also can help you plan where these implants are going to be placed also. So you can send us the information and then we can plan together where the implant's going to be placed, how many, what type of implants, and so on and so on.
Awesome. We probably have time for maybe a few more questions. And
Yeah.
then if that's the case, any additional questions we can send out to the group. In 2 slides, I'm going to give all of our contact information, but we will make sure to reach out and get you all of your answers once we provide you the recording.
We'll do a couple more questions. I do think we're wrapping up here, but the next one is, should I attend the in-person Zest Mastership Full Arch Education course? How is attending the course different from listening and learning from the webinars?
So yes, you absolutely should. So I just did the very quick, 50-minute Cliff's Notes version of overdenture therapy. The in-person course is an amazing, amazing course because not only are you getting 39 CE credits for the 2 days, there's an online component, but when you're live, you're doing didactic, then you're going right into hands-on. Whether it's in Las Vegas or it's regional, we bring this course throughout the country where you're have basically you're at a lab bench. You've got motors, you've got surgical motors, lab motors. We're taking impressions. We're measuring cuff heights. We're measuring angulation. You're actually doing chairside pickups. We do full pickups, swapping out inserts. We do surgical placement on a sawdust mandible where we're placing implants in proper position. We're measuring for implant, positioning. Same thing. We're doing pickups on those jaws. Then we do conversions where we have a full denture. We make it an overdenture. We convert it to a locator fixed. So we go through that whole workflow. Again, in Las Vegas, we also have a live patient component. We have a fully licensed clinic at our center, whether it's going to be overdenture, surgical, locator fixed, depending on where the patient is in their treatment. We like to get a live patient component. We have experts that are educating at our facility. So we keep it very interactive. We do a lot of case studies, troubleshooting. We have a business component where we talk about case selection. How do you get your patients to say yes? Talk about CDT coding, pricing, kind of everything. It's very, very comprehensive, not to mention a lot of fun. I go out there for all of the courses. We have a lot of fun. We do a team dinner as a class. We usually have around 40 to 50 students per class over the 2 days. Do a nice dinner on a Friday night. And again, it's a full day, a full 2 days of education. And again, great learning. And we've had some doctors that have come back and done it 2-3 times because not only is it great education, but we are always evolving and adding new information based off of what's coming out.
Yeah, I would, we love partnering with Zest. Your education is always top notch. So I would certainly reiterate that. I guess the rest of the questions we can address. We do kind of want to wrap it up, be mindful of everyone's time, but Amy is going to share all of our contact information and then we can go through and address the follow-up questions. But thank you so much for the engagement. This was awesome. And thank you, Amy. Excellent.
Absolutely. Absolutely. So on the screen is a QR code for your CE credit for tonight. So please scan that. Again, we're going to send all of this out. But lastly, I'm going to put on all of our contact information. If you have any questions on the webinar tonight, any questions on the laboratory or Zest, ordering components versus, our education, or even accessing this QR code if you have any troubles getting this, or how to register for our next webinar, those are going to be all of our contact information. Take a screenshot of that and please reach out to us. We want to thank you for your time tonight. I want to thank you, Lexier, for partnering with us. For Todd, Karen, Alyssa for joining us on this webinar. We look forward to seeing everybody on February 3rd at 7:30, and we will see everybody then.
Thanks, Amy. Have a great night, everyone.
Thank you so much.
Have a good night.